Now, Schwarzenegger is proposing a bill that's going to really make organ donation easier, that on your driver's license you have to answer yes or no whether you want to donate an organ, whereas now you can ignore the question. Now you...
Correct.
Yeah. Tell us a little bit about that and what led to that. Probably the Steve Jobs transplant.
So, Mr. Jobs' transplant may have brought some light to this. I think there is a benefit. I think right now when you get a driver's license, you can check off if you want to be if you're willing to be a deceased donor. I think I don't know the exact numbers, but there are a lot of people who sort of just ignore the question. Now, this bill is going to require that the driver's license form actually have you check yes or no. So it requires that you answer one way or the other. The idea is not to force people to say yes, but it's just to ask everybody to think about the possibility. Because if you are a deceased donor, you're potentially able to give life-saving organs to 7 different people, because you have 2 kidneys, a liver, a pancreas, 2 lungs, and a heart.
And the eye, the cornea. 2 corneas.
And the cornea, yes.
Right. So it's been a very exciting decade for all these advances, because now people are living longer. And are there now more centers, creating more centers? You know, is there more funding, Medicare funding?
Yeah, so actually the number of centers has actually stayed pretty constant over the time. Having a transplant center is very involved. It's really tertiary care. You need the medicine doctors, include the nephrologist for the kidney patients or hepatologist for the liver patients. You need social workers, because we talked about some of the social issues around transplantation. You need financial coordinators, because this is a very expensive undertaking. You need nurse coordinators who are really dedicated to getting their patients up on the transplant list, managing them on the transplant list. And obviously you need the surgeons, and then post-operative care is very complex. So you need a high-level intensive care unit. So I think this sort of puts a limit to the number of centers that actually can participate in this.
And that you were saying that for a center to be approved for kidney transplant is easier than for liver, or simpler, or the process, the administrative process for Medicare? Is it?
Yeah, I wouldn't say it's either. I think the resources are not quite as demanding as the resources for liver transplantation.
Because they recover from kidney surgery faster than liver surgery. Yes.
If I do a living donor transplantation on a Wednesday, the recipient of that living donor kidney often goes home on Saturday, and never goes into the ICU. While a liver patient that gets a transplant on a Wednesday may still be in the ICU for 5 days, and so it's a very intensive undertaking.
Now, for the people who get the transplant and the donor, let's say somebody is the kidney donor and there's somebody who's the recipient. The recipient feels good right away because suddenly their bad kidney is replaced with a good kidney. Now, for the person who donates a kidney, assuming they're healthy, they're in the hospital how long?
So, first of all, I think we should acknowledge the donation of these patients. It's always a dramatic story where it's a brother donating to a sister to a brother, or a spouse to another. The way we do it, they come in the day before surgery, both the donor and the recipient, just to do some last minute tests to make sure everything's ready to go for the transplantation. The donor will often have the donor operation on a Wednesday morning, and if everything goes perfectly smoothly, they leave the hospital on Friday or Saturday.
So if he donates on Wednesday, you harvest the organ, and it's a living kidney, and then the recipient gets it the same day? Is it the
recipient gets it immediately afterwards.
So your 2 ORs going simultaneously?
So the way we do it is sequentially. So they do it the same OR. The recipient comes back, the donor leaves the OR, goes to the recovery room. I make sure the donor is safe, and then we clean the room and bring the recipient back into the same room and place the organ.
And same thing for liver?
Liver, often it's 2 rooms sequentially. Like I said, doing living donor liver transplantation is a more rare operation. Only 200 are done a year in the United States. At Stanford, we do between 3 and 10 a year.
And you just do one lobe of the liver.
And you just take part of the liver. The liver is an amazing organ. In a healthy person, you can take 2/3 of the liver to transplant, and the remaining liver will regenerate within a few months to almost a full size again. The thing about living donation for liver, it's a more complex operation, and therefore there are some more risks to the operation than there are for living donor kidney operations.
Now we're going to wind up the show. Now for our home audience, the take-home message is that kidney transplantation is safer than it was 10 years ago, and that it is fairly straightforward if you go to the centers that are approved, and that you see your internal medicine doctor, then a nephrologist, and then you're referred. And the donors in the hospital for 3 to 4 days. They don't even go to an ICU. The recipient feels better immediately because their sick kidney is replaced.
Correct.
And for liver, there may be a little longer, 4 days or 4 to 8 days for the donor.
Yeah, correct.
And about the same, up to 2 weeks for the recipient.
Correct.
And that the recovery is approximately the same, maybe 2 months for each for the recipient for going back.
I would say liver is a little bit longer than 2 months,
longer.
probably 3 to 6 months.
3 to 6 months. And that both are expensive procedures, and that Medicare covers kidney transplantation, up to 3 years of drugs, and the treatment of end-stage renal disease. Whereas for liver, it is not covered by Medicare unless you're over 65.
Correct.
Right.
Correct.
So, and then if people have questions, there are numbers there for Dr. Melcher, emails and phone numbers for me. And if you like the show, donate to KSAR, and for public television, KSAR TV and cable access television. Thank you very much for joining us.